Hey guys, this is Doc Hoffpauir again, and this is our final video in my portion of this educational series. So I know that all the other videos have been pretty long, but as you're aware now, I'm sure, the principles of influence take a long time to cover, and they're very, very important for increasing your case acceptance in your practice. And I don't want to put you through that again, but I do want to give you some quick tips. So first thing, I want you guys to get a couple of books. The first one is Exactly What to Say, The Magic Words for Influence and Impact. Fantastic book. You're going to recognize a lot that we talk about in this section comes from that book. The next one is Building Your Story Brand. I know I spoke about this one in one of our mastermind sessions. It's a wonderful book, and I think you're going to get a lot out of it. In the first part of this series, I asked you a question, and that was, why selling? And I explained that we have a moral obligation to ensure that our patients receive the best treatment plan for their problems, and that we provide them the best possible service. The question I didn't ask you to think about is, why buying? Why do people buy? We talked about how people use their emotions to make decisions. But what emotions are they tapping into? One of the most famous studies ever done, it's referenced everywhere, is Maslow's hierarchy of needs. And a lot of work has been done on explaining exactly how that influences, or how those hardwired instincts influence our buying behaviors. And what we found is that almost all people buy for one of three reasons. And if you think about this, you can even apply it to the things that you've done and the reasons that you buy. The first is pain. Pain is actually the strongest motivator for buying. The second is fear of loss. Now, some people dispute the fact that fear of loss and pain are different. They say that fear is just fear of pain, because in some level, if you're losing something, there is pain involved there. But I think fear of loss is better separated, and so I'm going to present it that way. And the last reason that people buy is for potential reward. Now, because of the fact that on the very base of Maslow's hierarchy, that's where hunger and all of our needs are, including the need to be without pain, including the need to be safe. And so pain is the absolute biggest motivator whenever it comes to buying. The second highest motivation is fear, and very, very far distant, in fact, I believe it's 2 levels up on Maslow's pyramid, is desire for reward or seeking reward. Now, if you think about this in your daily practice, it's really a no-brainer. A person who comes in, who has an abscess, they're hurting, they're going to buy that day. And if they're not, you definitely need to work on what you're doing to present your cases. But 9 out of 10 times, if someone comes in pain, they're looking for a solution right now, unless you're a drug seeker. If someone comes in and they're concerned about something, how many times have you heard, I lost a filling and I want to get it fixed today? In my office, it's constant. So the lower you are on that triangle, the lower you're on that pyramid, the more likely the patient is going to buy, because they're already super, super motivated, because those are our driving forces. Now, higher up on the pyramid, let's say seeking reward, you're going to have a lot more resistance, a lot more time that they're going to want to think about it, and a lot more time they're going to consider, because when they're looking at gaining a reward, they're also looking at monetary loss. And so if you can separate that monetary loss, or their fears of the shortcomings of the reward, or their fears of not being satisfied with the reward, then you can definitely move your buyer closer to saying yes. I hope that makes sense so far. Now that you understand why people make a decision to buy something, what moves them to action, we can kind of begin to work on how those emotions play out and what we can do to guide your patient down the path toward choosing the treatment that you believe is most appropriate for them. I want you to think about these words: Just imagine. And how would you feel if? Now, both of these words can move a patient toward fear or toward reward. Okay? So imagine being able to eat the foods that you want to eat when you want to eat them. Imagine that freedom. So when you use the word imagine, it turns our brains on. They light up, and our little story reel begins to spin. And so the patients begin imagining and visualizing, and hopefully you guys understand the importance of visualization. They begin visualizing that outcome, what I like to call their victory. And so after I do that, and I say imagine that, and said, is that the victory you were hoping for when you came in today? So we've now painted this picture with our patient as the hero of this story. They're King Arthur. We're just Merlin. We're going to point to where the sword is, and they can pull the sword out of the stone, and they get to be king of the land, right? We are a facilitator of their happiness. Now, if you think about that, it's a very true statement. So the next set of words I want you to think about is, how would you feel if? Okay, so we're actually giving them permission to use their emotions in this decision whenever we use that phrase. So I want you to think about this. We're going to go up and we're going to go down. How would you feel if you could smile without worrying that your dentures would fall out? How would you feel if you never had to worry about being embarrassed because of them again? Okay. For a patient who's in a denture and who wants implants, that is a powerful motivator, okay? And it's important to understand the meaning of words. Motivation. Motivation. Reason to move. The word literally means reason to move, a reason to act. So we're giving our patient a reason to act. Now I want you to think about it from the opposite direction. How would you feel if, in let's say 3 years, your teeth are all gone? You won't be able to eat the foods that you love anymore. You won't be able to smile or talk with confidence anymore without worrying what people were thinking when they saw your mouth. I want to avoid that for you. So why don't we talk a little bit about what I can do to help to get you from here to where you need to be. Okay, you may notice I used a pause on the end of that. One of the techniques that I use a lot is pausing after giving a call to action, okay? A lot of us, we overtalk our own call to action. And I think it's because we don't recognize it for what it is. We don't realize that I've just asked the patient to make a commitment. Okay. Now we talked earlier in the section on consistency and commitments, how important small agreements are to be stacked on top of each other. All right. And small reciprocities to be stacked on top of each other. So we want to make sure we utilize that by giving a pause, giving the patient time to consider that there has been a question asked. And the pause, in fact, itself is an interrogatory. It says, hey, there's silence here. You need to fill it, because we don't like silence. Now, I want you to practice on your family. I want you to role play this. How about this one? So, I saw that the dishes in the sink were full. Now, let's be honest. How long did it take for me just being quiet for you actually to start to feel a little uncomfortable, you know? You want to feel that silence. You want something there. And if the other person isn't going to feel it, you are going to. Now, there's an old adage that says the first person to talk loses. I don't know that it's about that. I think what it's about is breaking down your patient's internal barriers, because they all have them up, right? These are conversations they don't want to have. So whenever you leave a big bucket of silence there, they're going to fill it with something. And so they're going to start talking. And once they start talking, you're building rapport. So anyway, absolutely magic. Use the gift of silence. The next thing I want to talk to you guys about is 3 options. Patients want autonomy. And if you remember, we talked about autonomy increasing liking, right? So if patients want autonomy, and you're looking in their mouth and there is a grenade that went off in there or something, and you know exactly what needs to happen, the best way to approach this is to tell the patient, look, there are a whole lot of different ways to fix your problems and to get you healthy. But the way that I see it, you have 3 best options. May I explain this to you? Okay. Now you're taking a little bit of a risk there because you're asking a permissive question and you're giving it as a simple yes or no. And so they say no, well, you're going to have to go digging. You're going to have to find out why they said no because they have an objection to something. If they say yes, you've just reached a commitment. So you have a small agreement on the table, and that means that you're building rapport. Okay? So the way I see it, Mr. Smith, you have 3 options. Now, whenever you present these options, first of all, make sure they are the 3 options and 3 viable options. I want you to present the first option and the third option being your least favorable options and the middle option being the one that you want the patient to choose. Okay? So whenever we're presented with information and we're presented with 2 sets of information, we tend to remember the last piece of information given to us more than the first piece. And there have been countless studies on this, even down to physical pain or a feeling of hot and cold or what have you. The last piece of information we get or the last input or stimulus we get is what we remember most. And so what you've done is you have given truthful information about these 3 options for the patient. And you've guided them toward the one that you believe is the right fit for their needs, for their wallet, and for their desires. And the way you've done that is by presenting the most favorable information first and the most unfavorable last for the options that you really don't think fit them. And you've presented the option that you do want them to choose with the bad information first and the good information last. Just a little technique. It works fantastically. Now, the next part of that technique is the sandwiching effect, right? So you may remember that we talked about the effect of comparing 2 things. How whenever you compare 2 to 3 things, you amplify the distance between them. And so in this case, not only are we showing them this contrast effect of the very, very high price and the very, very low price, because mentally we actually have this bracket where once something is a certain price, we consider it to be quality. If it's a higher price, we consider it to be something that is overly expensive. And if it's a very low price, we consider it to be cheap and undesirable. And so what you're doing is you're actually setting up the middle price to be the thing that your patient sees as, by contrast to the others, the acceptable price that they're going to want to pay, or that seems reasonable for them to pay. The other thing that you're doing here is people tend to pick the middle option of almost everything when they're unsure. And so if you have something at this extreme and you have something at this extreme and you set what you want in the center of those 2 things, our little cheat in our brain says pick the middle one. So we're reinforcing pick the middle one by also setting it up as the price that we're creating in their mind as the reasonable price in contrast to the other 2. Now, bonus for a combination of a little bit more advanced technique, you can use that same contrast effect by using the imagine and how would you feel if comments together. So you first create a floor with the how would you feel if, and then you use imagine, and that actually amplifies the distance between those 2 things, which causes the reward in imagine to seem that much greater by comparison than if it was used alone. Okay, so I'm going to do this for you now, and you can see what it looks like all put together. As far as I see it, you've got only 3 options here. If we try to repair your teeth, I don't feel good about us having a great outcome, and I certainly couldn't guarantee it would work. I think that we've reached the point at which we really need to extract them. So I believe that the best option for you would be a hybrid denture. Now, the good things about those is that hybrid denture, it screws into implants in your head, so it's not like a denture that normally just comes out. And it really is life-changing. It works very well. Now, the bad about that is that it's a very time-consuming process. It's going to take a long time to get done correctly, and it's rather expensive. Our next option is a denture that is removable, but it snaps into place on implants. Now, the bad thing about that is that it's not going to screw into your head so you can't take it out. But the good news is it's easier to clean, and it's a lot less costly than the first option. Now, finally, the last option I'll present to you is just a pair of conventional dentures. Now, the great news is they're relatively quick to get done. Depending upon how we do it, we can have a set of teeth for you the same day that we take the teeth out. And honestly, it's the least expensive of all the options. Now, the bad thing is that you're probably going to feel like it's the worst decision you've ever made in your life, because dentures are hard. They're just not a real replacement for teeth. They're a replacement for not having teeth. And I hope you understand the difference there. They fall out at the most inopportune times when you're laughing or smiling or eating. They don't chew well, but it's better than not having teeth at all. So, what are your thoughts? Okay, now your patient is going to feel the silence there, right? They're going to start talking about different things. Just listen to them. Let them ramble for a little bit. And almost always they're going to ask you, well, what do you think? And here's where you look like the good guy, all right? And I did this for years when I worked at Service Merchandise. I was the youngest manager in the history of Service Merchandise. And for those of you that are not old like me, that's a store that no longer exists. But that wasn't my fault, I promise. So what I would do is I would line up 3 treadmill models, and I would point to the expensive one and talk about all the features, and then I'd talk about the price. Then I would point to the middle one, and I'd talk about the price first, and then I'd talk about all the features. And then the last one, I would talk about all the features, and I'd talk about the price. And then I would talk about how many we had returned to the store because the belt breaks or what have you. All honest, all truthful. And that's the big thing about these stories that you tell these patients. They have to be truthful. We had a couple of our members of the coaching session that asked for very specific things to be covered in this technique video. So the first is overcoming financial objections to treatment plan acceptance. So guys, whenever you're talking to your patients, it's important that you understand how the consumer mind works these days. They think in monthly payments. They don't think in big numbers. And so big numbers scare them. You first present the treatment plan in the form of a monthly payment, and then have some great third-party financing options available for your patients. I'm going to suggest a couple of them right now. One is Ally. Ally Bank does a great job. I believe they can finance up to $35,000, and they can finance down to a 558, although 558 is uncommon. Depends upon their debt-to-income ratio. So whenever you're looking at these things, you have to remember that just because a patient has a great credit score doesn't mean they're going to get financed, because their debt-to-income ratio might be too big. The next one I'm going to suggest is United Medical Credit. United Medical Credit can finance up to $15,000, and they can, I believe, it's a 520 that they can finance down to. They have actually what they call a waterfall system, where the patient drops into the system at the top. It does a soft credit check at a bunch of different banks, and it finds the lender that is going to lend them the most money, that actually accepted them as a lendee. And so that's a really, really nice one. And the last one I'm going to talk to you guys about involves you taking a little bit of risk, and that is compassionate finance. Now, I use them in my office. I was worried and nervous about it whenever I first started using them. I think I've only had 2 patients default since the beginning, and I kind of thought those patients were going to default anyway. Now, they tell you at Compassionate Finance that they want you, and by the way, I have no financial interest in Compassionate Finance, at least not currently. They may sponsor us or something in the future, but I currently do not have any. They will usually tell you to take 20% down. I always recommend 30%, because at 30%, you can do almost anything and cover your lab fees, cover your labor, and basically your cost of goods sold. So you want to make sure you have that covered, so that the only thing you're taking a chance on is the actual profit above and beyond operating costs, because you never want to risk that. Now, here's the nice part. Taking that chance on the patient also comes with all that interest that they would normally being paid to the bank, being paid to you, which you split with Compassionate Finance. Closing the case in the operatory. Now, I'm going to go against what a lot of people have to say here. If a case is under $5,000, I close it in the operatory. If it's over $5,000, I always close it in the consult room. One of the things that was asked in the group is, how do you present an ideal treatment plan without sounding salesy? And you don't want to sound salesy. You may recall I talked about a Gallup poll that was recently done, and salesmen is the least trusted profession in the United States. They even come in under congressmen and senators, not that far, because those are number 2 and number 3 least trusted. But definitely you don't want to come off sounding like a car salesman. As long as when you're trying to sell to a patient, your heart is in the right place, which is you're trying to help the patient, that comes through. People will listen if you show them that you genuinely care about them. So, as a for instance, Mr. Smith, I'm really sorry that your mouth has gotten to this point. Between the periodontal disease and the broken teeth that we're seeing here and the abscesses, fixing your teeth and repairing them back to a point approaching where they're as good as new would be very, very costly. And it's definitely an option that we can explore. It really just depends on your budget, because my job as the doctor is to find the place where your budget intersects with what you need and what you want. And so I'm going to ask you a couple of questions about what your goals are for your own oral health, and it's going to allow me to formulate a much, much better plan for you. Okay, so I have 5 rules that I always follow. It's kind of, remember we talked about codes early on in this presentation? Well, this is kind of my code of trust and integrity in the sales process. The first is always have the patient's best interest at heart. Always. The next is always provide a comprehensive treatment plan. Everyone deserves that. I don't care if you don't think they can afford it. And let me tell you, many people will surprise you. I had a chicken farmer who pulled out $50,000 out of their pocket in big bills because they were ready to get a denture with some implants. So always, always, always present comprehensive treatment. It's good for you. It's good for the patient. Always, the patient must have autonomy. You have got to allow your patient the freedom to choose. Next, under-promise and over-deliver. Cannot say that enough. Under-promise, over-deliver. And last, good works well publicized. If you're going to do something for this patient and you're going to give them a price cut, it needs to be on the bill that way. People forget what you've done for them unless there's a commitment, written, signed commitment. Remember about that? So when you do decide to give someone a discount to help them out, or you give them a package deal, first you print out every single line item, and then you have a separate sheet that details what the package deal is. And then you have something on the bottom that you write savings, and you put a big number, our gift to you. So those are my 5 rules for trust and integrity in the sales process. Use them and you will never come off sounding like a used car salesman.